Hi everyone, I'm Dr. Rakesh V. I'm a critical care specialist and an ECMO physician from Hyderabad. See how to minimize the risk of infections inside the ICUs. So till now we have discussed different points like ICU infections, the most common bacteria that is causing ICU infections, what are the common sources of these bacterial infections inside the ICUs, and the most common neglected things and what are the answers for that. So let us see how to prevent these ICU cross infections. You need to have recent protocols which are to be recently changed for the emerging bacteria. What I want to say is that your protocols has to be like stringent and your protocols has to become strong day by day apart from the bacteria which is also becoming strong day by day. Rigorous hand hygiene practices. So in one study they say that a proper hand washing technique will decrease around 60 to 70 percentage of cross infections inside the ICUs. So rigorous hand hygiene should be done by all the staff and then by all the visitors and even the doctors. The doctors are not immune for making your hand hygiene here, and the bedside staff should take care of this responsibility whenever a visitor comes to the patient's bedside, and before touching they should have their hands washed. Routine cleaning and disinfection of all the common surface areas which are in common for touching, like bedside rails or the bed foot rails, etc., or the monitors or the probes which are generally goes in touch with the patients. Any equipment, this should be routinely cleaned and disinfected, and routine swabs from this equipment and bed surface has to be sent for the surveillance purpose to prevent any outbreaks in our ICUs. Proper sterilization of all medical devices which we generally use, and now you have to sterilize your textiles also. You have to properly launder your ICU patients, properly regularly change the ICU uniforms of the patients, and possibly the usage of antimicrobial fabrics which are generally increasing the recent trends. These are also all the vital steps to reduce the contamination of the cross infections inside the ICUs. Before going and changing the bed sheets for every patient, and then the sheets which they are going to cover up for the patients, the pillow covers, all these things should have proper sterilization protocols so that we prevent the cross infections here. And unit of isolation protocols should also be very stringent for all your infected patients or colonized patients. And your antibiotic stewardship program, as I'm telling prior, this stewardship program should be made much stronger for the emerging infections. And last but not the least, continuous staff education. This is not a one-time step, or this is not going to be a single menu that is going to come down on infections. It's a routine process that should happen on a day by day in your ICUs here. So it should be a continuous staff education, and then the feedback mechanisms, and then the surveillance cultures that will decrease your ICU infections. So all these steps they collectively form the backbone of the infection control, especially in critical care settings. So let us come to a conclusion that infections in ICUs they pose a serious threat, but that can be controlled to have a diligent infection prevention practices. You need to understand what are the sources. You need to see what are the sources that are going to be frequently missed or frequently overlooked, just like what we discussed, like the hospital textiles. So all these things, and then frequent teaching, and then educating your fellow staff beings, and continuous feedback mechanisms and surveillance cultures. So all these things put together, they helps us to create a safer environments for our most vulnerable hospital patients or ICU patients especially. Thank you so much for your attention, guys.